Namaskara and a very good evening, ladies and gentlemen, and all the beautiful couples out there. My name is Ruchika and I'm going to be your host for the day. I welcome you on behalf of NU Fertility Center. NU Fertility Center is equipped with comprehensive assessments for both male and female infertility related issues. Currently, there are 3 different branches of NU Fertility Center in India, out of which 2 is in Bangalore. Today, we have Dr. Ashwini S. with us. But before we go to her, let me quickly give you some briefing about this wonderful personality. To talk about Dr. Ashwini S., DGO DNB firm is the senior consultant and head of the Department of Reproductive Medicine at NU Fertility Center. She has been dealing with repeated IVF failures since last 10 years. So doctor, how are you?
Yeah, thank you for the introduction. So it's been great being here with you, and today I'd like to discuss about the topic of unexplained infertility. The reason why I have chosen this topic is because when you know that there's a problem associated with infertility, people go and approach the doctor and get it treated. And many people, where they find that everything is all right, they are misguided as they are actually told to wait and do nothing until they conceive on their own.
There are myths also, doctor, about this. Yeah. So, dear viewers, here we have the reality check. Let us get our facts checked by the doctor today. Facts checked by the doctor today. So we have listed down some questions and the doctor will take us through them. Shall we begin, doctor?
Yeah, sure.
When should a couple seek treatment for infertility?
See, ideally, infertility means when a couple is unable to conceive after 1 year of unprotected intercourse. That's when they should approach the doctor and seek treatment. But as obvious features, for example, if a woman doesn't have regular cycles, if she's having cycles or periods once in 2 months or 3 months, they're obviously not ovulating. So these people should seek earlier treatment. Or some people may have sexual dysfunction, or they would have been affected with orchitis or whatever, testicular infection or something very obvious like tuberculosis. These are the people who should approach the doctor at the earliest. So even 6 months of wait is enough for them to go and approach a doctor and seek the treatment.
What are the tests recommended for an infertile couple?
See, whenever a couple comes to us, the most important thing is the history, because just doing the investigation will not suffice. Many a times we do all the tests and we forget to ask about the sexual history. There are plenty of couples who have sexual problems and they don't come up on their own unless we probe it and inquire it.
Moreover, I feel that they are a bit more hesitant as well to come up with this.
Come up on their own. So the most important part of evaluation is the history. As I already said, most important thing is the age of the female, the duration they have been married for, and if the woman has a regular cycles or not, and the most important thing, if they've been trying regularly or not. Because they would come with a big file and at the end of it, when you probe them and ask, they have not tried at all. The problem is the sexual dysfunction. So apart from that, when you're done with the history, then we come to the investigation part. At the minimum, for the female, we do an ultrasound. That gives us a lot of information. I'll come to each and everything later on. So apart from that, we also test a few hormones. That tells us how the ovaries are functioning, how the eggs are being produced. And also we do the husband semen analysis. Semen analysis is also again the most important part of the investigation, because we come across many couples and husbands are hesitant to get a semen analysis done. They're like, you treat my wife first, after that I'll get the test done.
It's a big taboo altogether.
Yeah. So that is not the way it should go. So male and female infertility, both of them contribute to about 50% of the incidence. So it's equally important to test the male at a minimum a semen analysis and a sexual history whenever we're dealing with investigation.
Okay, now we will proceed with the next question. What are the important hormones tested and can we know about their significance?
See, the importance of hormones lies because it tells us about the ovarian function or how the egg is being produced. So one way of assessing it is to do a serial ultrasound and to see if the eggs are growing. The other way of assessing is to do the hormone test. So most of these infertility hormones are done on the period second or third day. This is because the values vary throughout the menstrual cycle. So we need to know the baseline values. So most of these tests are done on the second or third day of period. So the important ones are the FSH, LH and the estradiol hormone. This tells us if the woman has a low reserve or a high ovarian reserve or a normal ovarian reserve. Apart from that, we also test for thyroid hormone. This again has a very important bearing on the ovulatory function of the woman. We also test for something called prolactin. Prolactin is a hormone. When it is very high, it affects the ovulation. At the same time, when it is very high, some people also become symptomatic. They get what is called as galactorrhea or breast secretions. So if a woman has breast secretions, that should point to us that even though everything is normal, she may not be ovulating properly. So apart from that, the most important hormone what we test is the AMH or the anti-Mullerian hormone. So anti-Mullerian hormone points us exactly where the fertility of a woman stands. So it tells us how much is the reserve, and most of our treatment depends on where exactly the reserve stands.
So in that case, we can say that ultrasound plays a very important role for a woman to get it done.
Yeah, that is a basic investigation and it gives us a lot of information. Main thing is about the structure of the uterus. So unless, because it's an internal organ, unless we image it, will not be able to know anything. So the important problems which we can encounter in the uterus is the uterine abnormalities. See, usually the uterine cavity is a triangular cavity which is sufficient to hold the fetus for the 9 months. But sometimes during the development there could be problems. It could be split into half. It could have only one horn, which is a smaller cavity, or sometimes because of infections there could be adhesions inside the uterine cavity. Or many a times we also come across abnormal growths called fibroids. If they're very big, they in turn can affect the implantation and the fertility. So apart from that, we also get to know the ovarian function. So we know what is the egg reserve, how the follicles are developing, how the ovulation is happening. This also forms an important part of the treatment. Yeah.
How do you test the fallopian tubes?
The fallopian tube forms an important part in natural conception. So it connects the ovaries and the uterus, and that is where most of the fertilization of the egg and the sperm meet, and the first 5 days of the development happens. And what we need to know is it's a very tiny structure and the lumen is hardly about 1 millimeter. So it can get blocked, or there could be some debris sitting there which can actually lead to a block. So if somebody is not conceiving when everything is normal, it's also important to test the fallopian tubes.
Okay, so fallopian tubes can also be one of the reasons.
Yeah, it can be one of the reasons. And the other thing is, when we are testing the way we test the fallopian tube is by a simple test called HSG. So what we do here is we push some dye through the vagina into the uterine cavity, and if the tubes are open, it comes out and spills into the peritoneum. We take an X-ray, and that is how it gives us the information. Apart from being diagnostic, it is also therapeutic, because sometimes the minute blocks can be cleared while doing the HSG. So we have come across many patients who have conceived after the immediate cycle after the HSG. So it's just that the tubes have been flushed and it has been made patent. The only thing we don't do it as a first line treatment is it's a little painful, not exactly very painful, but it's tolerable. Okay, but since it's a painful procedure, so we keep it as after 1 or 2 cycles of induction phase, then we do the test. But we can also get it under anesthesia if the woman is very afraid of getting it done, because most of them, as soon as I say HSG, they Google, and then before I start the procedure, they start crying. So if they're very scared, we can also do it under IV sedation or anesthesia.
Google, actually, yes, in a way it's a destructor also. I mean,
no, especially with the HSG, before they come, they start crying. I'm like, what happened? You Googled? Yes, I Googled, because they would have written the reviews that it's a very painful procedure. And the other way of testing the fallopian tube is if you're doing a laparoscopy for some other reason. At the same time, we can inject the dye from down below and visualize it directly if it is coming out of the fallopian tube. So usually laparoscopy is not used as a first line diagnostic procedure, because we need anesthesia, we need to, it's a surgery basically. We need to just put the scope and then see. But if we are doing laparoscopy for other reasons, so it could be an infection, it could be an ovarian cyst removal, or it could be a fibroid removal, at the same time we can test the fallopian tubes as well.
Okay. So how should one do a semen analysis?
Yeah, again, semen analysis is the most important part of the investigation of infertility. So when we are asking somebody to do a semen analysis, we ask them to maintain an abstinence. Abstinence is after intercourse, 2 to 5 days they should give a gap and then give the semen sample. So this is because if they give very early, there could be very few sperms in the sample, and if they take a longer duration, there could be many dead sperms in the sample, which gives us a false report in terms of motility and morphology. And once we are told to collect, it is better to collect in the clinic or the hospital. The sample has to be collected there. But for some issues, if somebody wants to collect it at home and then get it to the center,
that
usually, yeah, they have to preferably get it by 30 to 45 minutes once collection is done. So apart from that, when they're getting it from outside, they have to keep it at the normal temperature. They can just put the container in the pocket, and you can't collect the semen in whichever container you want it. So we have specific containers which are non-toxic to the sperms, and the semen has to be collected in those containers.
Okay, so now we come to the agenda, today's agenda of the topic, which is unexplained infertility. So what is unexplained infertility, doctor?
See, as I said, the 3 main basic tests we do is an ultrasound, the fallopian tube test, the imaging and the hormones of the ovaries, and the semen analysis. When everything turns out to be normal, that is when we say it as unexplained infertility. Because grossly whatever we have tested has come out as normal. So the reason I am stressing on unexplained infertility is many couples have been counseled that everything is normal, you go home and try. So that should not be the way to counsel them, because they have been doing that for the last couple of years, maybe 3 years, 5 years only, some people even 10 years also. So when you have not found anything grossly, there are multiple problems which you can encounter. So this forms a very big chunk of the infertile population who are always misled and they don't approach the treatment at the right time.
I'm interrupting you here, doctor. I just would want to ask you this question. Is there any age criteria for a woman and for a woman especially to conceive, or is it a myth? I mean, a woman can conceive at any age.
Age of a woman is the most important aspect of fertility. So as what we need to understand is women are born with a limited number of eggs. So from the time of birth or even in the intrauterine period, they start depleting. So after 30-35, the eggs drastically go down and even the quality goes down. So there's an increased risk of chromosomal problems and all these abortions, all these problems crop up. So it is better to plan the pregnancy somewhere around less than 30 is better, but still 30 to 35 is acceptable.
Yeah, because
but
these
beyond
days,
35, yeah.
Couples, they tend to get married late.
Yeah.
So everything then, takes late.
Beyond 35, it's usually not desirable. Okay, so whatever we try to do, it will be like we are going against the biological clock.
How to deal with unexplained infertility?
See, as I said, like the most important aspect of unexplained infertility is we need to try and dig out and find out what exactly is the reason. 2 important factors affect here. One is the age of the female and the other one is the duration for which they are married for. So if they are married for less than 3 years and the female age is also less than 30-35, then we can still go a little slow. We can try to optimize the whole treatment by doing some ovulation induction, or for that matter even an intrauterine insemination. So these things usually have a success rate of about 20-25%, and if 3 to 4 cycles of IUI has not worked out, that is when we should consider doing an in vitro fertilization or an IVF treatment.
I was coming to that. Doctor, is IUI recommended for unexplained infertility?
Yeah, as I said, if they're of an age between 30 to 35, less than 30 to 35 years, and they're married for a short duration, maybe 3 to 5 years, then in such patients we can still consider doing an intrauterine insemination. So what happens here is we kind of stimulate the ovaries to produce about 2 or 3 follicles, and at the same time we process the semen and directly inject into the uterus. So basically we are increasing the probability of fertilization. So more eggs, more sperms. So we hope to get more good number of embryos and implantation.
So now that we know about IUI, what is the procedure for IVF?
See, IVF is indicated if usually around after 4 or 5 cycles of IVF. We usually don't go up to 5 cycles, 3 to 4 cycles of IUI. If it fails, that is when these people should consider doing an IVF. And also if they are married for long duration or the age of the female is already more than 35, the ovarian reserve is going down, the AMH value is very less, these are the people who should take up IVF straight away. Yeah.
And how long would it take for IVF?
See, for that we need to understand the procedure of IVF. See, the aim of IVF is to get good number of eggs from the woman. So we usually aim at getting some 14 to 15 eggs. That is because we have to try to balance between being greedy and at the same time not to put the women into trouble. So to get that, we need to stimulate the ovaries. So this usually takes about 8 to 10 days for us, and it usually includes the hormone injections for about 8 to 10 days. And this is usually starting from the second or third day of period. So once the eggs are ready, we go through a procedure of egg retrieval. So this is done under usually anesthesia. We give IV sedation. It's about a 10 to 15 minutes procedure through the vagina only under ultrasound guidance. We put a small needle and aspirate all the eggs. So once we have the eggs in our hand, we screen them, take out the good ones in the laboratory, and then comes the procedure of IVF, or what we call as ICSI, intracytoplasmic sperm injection. So here what we do is, for each mature egg, we select a good sperm in the lab and directly inject it into the egg. So after that, we culture the embryos. Culture means grow the embryos in an incubator at the optimal condition. So this usually goes on for about 4 to 5 days, and this is when we come to know which is good and which is not good. The good ones are either selected and transferred into the uterus, or there are criteria in which we don't like to transfer in the same cycle. We freeze everything and put it back in a later stage as a frozen embryo transfer. So basically the entire procedure takes about 12 to 15 days. Taking out the, stimulating the ovaries, removing the eggs and making the embryos and putting it back into the uterus.
Will this be painful? I'm sure our viewers would want to know about this as well.
Yeah, that is the most important part. See, injections are little bit painful, but we have come nowadays we have all the subcutaneous ones which can actually be self-administered. So it's not that painful as it is like.
But I think the curiosity and the willingness of having a child will dilute all these.
It's a small subcutaneous injections are the ones which are like insulin injections. People take it on a daily basis, and many of them they can prick it on.
So will they have to come to the clinic, or can they?
If they're well educated and if they can manage the whole thing, if you can show it to them, most of these injections can be taken at home, so by themselves. So in between we have to monitor the response. So probably about 3 times or 4 times they may have to come to the hospital for scans.
Okay, so what are the precautions to be taken during embryo transfer?
See, as I said, embryo transfer is the last part of the IVF. So we have everything in hand, we have to put it back into the uterus. But it is the most important and the most crucial part of the IVF cycle. So even though the embryos are good, at least 30% of IVFs fail because of faulty embryo transfer. Because embryos are so delicate and so tiny that little bit of handling, little bit of change in the temperature, little bit of change in the pH of the media, that can cause the embryos to degenerate. So it's a very meticulous procedure, and usually we do it without anesthesia because it's not painful as such. So what we do here is we do it under ultrasound guidance. So we have an abdominal ultrasound which guides us as to where my catheter is going. So the embryologist loads the embryos. We usually go for 1 or 2 embryos, and they are given it to us. When they give it to us, we negotiate the uterus under the scan guidance and deposit it at an appropriate place. So the most important point here is it should be as meticulous and as pain-free and as struggle-free as possible.
Lovely. Is rest required after IVF?
Yeah, that's the most important point which everybody wants to know.
Especially the working women, you know.
Yeah, that's the reason why they have been postponing IVF, because they have to do it when they have the leaves or when everything else is settled. See, actually there are plenty of studies which have noted down if the embryo get displaced after the movement, with the movement, or if they're doing some vigorous exercise or something like that. So they've radio labeled the embryo and tried to study it. There have been
so
plenty
then
of
it's a myth when we say that
patients have to rest.
Yes,
exactly.
exactly.
When natural conception happens, we really don't even know, we would have done everything on the earth. So the same thing applies here also. So rest is not mandatory, but what happens is, all said and done, if the cycle doesn't work out, so it kind of it gets deeply impregnated that because I climbed the stairs or I did this, I went to work, that's the reason I didn't implant. So if
the person
it
has
permits
to be
them to
cautious.
Yeah, if it permits them to take leave and stay at home, that's fine. Otherwise, it's not mandatory. They can get back to their work as early as possible.
So do patients need a lot of medications after IVF?
Yeah, I don't say a lot of medication, but some supportive treatment is required, because IVF is slightly different from the natural conception. See, when we take out too many eggs from the ovaries, we also kind of deplete the cells which produce the hormones. So those hormones which are required for the implantation process has to be given from outside. So there could be a few injections for about 10 to 15 days after the transfer, but most of them are the tablets which they have to take it. So this will be gradually reduced once the implantation and the placental development, everything starts happening, usually around 8 weeks of pregnancy or maybe up to 12 weeks of pregnancy. So once they cross the 3rd month, it's like any other natural pregnancy. So everything comes back to
I think it's just like how women gets conceived, in a natural span, as in naturally, because
no, there's a slight difference because as I said, like many transfers are done in the frozen transfers. In frozen transfers, there are 2 ways of growing it. So we kind of allow the women to produce the egg and synchronize the transfer according to the hormones produced by the egg. So that it requires a lot of monitoring and very meticulous watch. So the other way of doing it is we suppress our ovaries and we give all the hormones from outside. So that makes it a little easier for us to time the transfer and the cycle.
And I guess if the person is blessed, they might experience twins. More chances
that is again in our control. So because there are people who insist on a single embryo transfer.
Okay.
So when we transfer a single embryo, the chances are about 40-45%.
Okay.
So but if they are willing to take a chance.
But that is only if they ask. Or is there any way out?
If given an option, we would like to do a single embryo transfer for everybody because twins has its own problems. But at the same time, they have to accept the success rate of 40 to 45%. Because even though the embryo looks good, it could still be a chromosomally abnormal embryo. To balance that, usually we go ahead with 2 embryos. So that's when we end up having twins. Yeah.
Okay. So my next question is, when will we know the results of IVF and what is the success rate?
See, once we transfer the embryos, we need to wait for about at least a minimum of 10 to 12 days, or usually after 2 weeks we'll get to know the results. They can usually do a urine pregnancy test, but we don't insist on a urine pregnancy test because the beta-HCG will be very low and sometimes the commercial kits may miss the result. So it may not detect those levels. So it's better to do a blood test called beta-HCG approximately after 2 weeks after the embryo transfer.
How successful is IVF in these patients?
See, IVF generally has a success rate anywhere between 60 to 65%. But when it comes to the patients, there are multiple factors which play a role. The most important point is how good the embryo is. And about that contributes to about 80% of the IVF success rate. And then comes the uterine receptivity and all that. That contributes to about 15% or maybe 20% of the IVF results. So usually the results success rate on an average is about 65%.
Okay. My last question for the evening, doctor, it is that what to do if IVF fails?
Yeah, this is the most important thing because people get depressed and they think that if IVF has not worked, nothing works. But as I said, first thing is you need to analyze why the IVF cycle has failed. Is it because something to do with the embryos? Is it because something to do with the procedure which has gone wrong? Or is it because something to do with the uterus which is not holding it? So many a times the embryos may not be good, and we have had plenty of cases where we have asked them to try naturally and given them adequate support. People have still conceived naturally. So IVF is not the end of the whole journey. So even when IVF fails, you can still conceive naturally. Or if you can analyze the cycle properly and find out where the problem has happened, we can attempt a repeat IVF cycle and then go ahead. So the most important thing is we need to analyze the cycles. There are patients where everything looks to be normal. We have good embryos, good uterine lining, everything has been perfect, and if they still fail, then we need to do the second line test. So one of these tests is the endometrial receptivity is what we assess. See, each person has its own window of implantation, and most of them, though it happens, 90-95% of them fall in the window of implantation where we actually plan the transfer. There are about 5 to 10% where it is displaced. So unless we transfer it at that time, how many ever times we transfer, it won't implant. So apart from that, we also have something called hysteroscopy, wherein we put a camera inside the uterus and see if there are any problems inside the uterus. Or sometimes we also come across the swollen tubes. So many a times these are not visible by ultrasound and it may go missed. So we need to test them meticulously, and if they are swollen, they need to be clipped before we go ahead with the transfer.
So is there any number of IVFs, that maximum number or attempts a person can go for?
There is no cutoff as such, but we would not advise them to go beyond 5 IVFs with their own cycle. But 2 or 3 should be fine, because the ultimate thing is after 5-6 cycles we really don't know the effect of the hormones. We don't have any long-term studies regarding that. So in that case, like probably if things are repeatedly going wrong, you should explore alternate ways like a donor egg or the donor sperm. So that's the reason. If something fails, we need to analyze the IVF cycle properly. So what is most important, they should not throw the reports. Because as soon as the IVF fails, the first thing they do is throw the reports and come empty-handed with to the next center. So if they keep the reports, we will not be doing the same mistakes again. We know where we have gone wrong and we can correct the mistakes.
So they should also have a lot of patience and never giving up spirits.
Yeah. See, we have had at least a few patients who have conceived in the 6th or 7th attempt also.
Oh my God.
And they have been very, trustful and like, yeah, at last it has worked for them. And we've also had patients who have conceived with single embryo. Again, the trust is what makes it. And we have had patients where IVF has failed and they've conceived naturally.
Oh my God.
So all of them, they've come back to us even after repeated IVF failures, and they've put the trust on us, and that is how we have been able to help them. So,
thank you, doctor. Well, that was a wonderful session, and I'm sure that our viewers have got the clarification on these areas. Moreover, if there's any doubts or queries, you are most welcome to visit our main branch. Doctor, of course, she will be here and she will be here to help you. On this note, thank you, doctor. It was lovely having you here, and it is honored to be a part of this wonderful session.
Thank you so much.
Thank you, people. Everybody, stay safe, stay healthy. Take care.